Okay, so let's unpack this a bit. Telehealth, I mean, it's really reshaped how we think about getting healthcare, hasn't it?
Oh, absolutely. It's essentially opened up access in ways, we probably couldn't have imagined just a few years back.
Right. And today we're going to do a deep dive into how you actually choose a telehealth provider. I've got a specific resource here focused on one provider, Stark Medical, and we'll be looking at it through the lens of Northern California's unique situation.
That's the plan. Our mission really for this deep dive is to understand those core factors you should be considering when you're picking a telehealth service. And then, yeah, we'll see how the information we have on Stark Medical lines up with those points, especially thinking about those very real access challenges people face across Northern California.
Because Northern California, it's such a mix, isn't it? You've got the bustling urban centers, sure,
Yeah.
but then it stretches out so quickly into these, well, sometimes pretty remote, even isolated rural communities, thinking about, the redwoods, that rugged coastline, the
Yeah.
mountains.
Exactly. And that geography, beautiful as it is, creates some significant hurdles for actually getting health care. For a lot of residents, seeing a specialist or even just a routine checkup can mean driving like really long distances.
Right. And public transport often isn't really an option in many of those spots, assuming it even exists.
Yeah, exactly.
The source material we're looking at, it really hammers this home. It points to specific counties, Mendocino, Humboldt, Butte, Shasta, as places really grappling with these ongoing provider shortages.
It paints a very clear picture, doesn't it? These kinds of gaps in local care, they can lead to some serious problems. We're talking delayed diagnoses, chronic conditions that aren't managed effectively.
Which is so dangerous.
Totally.
Yeah.
And sadly, it often means people end up in the emergency room for things that, well, could have been handled much earlier if they just had regular, accessible care.
So this is really where telehealth steps in as that vital solution the source describes. It basically takes travel out of the equation. You can connect with a doctor or therapist right from your home. hmm Saves time, saves money, saves hassle.
Yeah, and just makes it genuinely easier to keep up with those regular appointments, which for managing ongoing health stuff is just huge.
And it's fascinating, actually, the sheer range of conditions telehealth can help with effectively. Our source mentions quite a list, handling common things like a cold or the flu, providing really crucial support for managing chronic diseases like diabetes,
Okay.
offering evaluations and therapy for mental health conditions, say anxiety, and even facilitating care during substance use recovery.
Including things like medication-assisted treatment?
Exactly. MAT meet for alcohol and opioid addiction. It covers a lot of ground.
Okay, so with all that potential, how do you even start sorting through the options? How do you pick the telehealth provider that's right for you? The source we have gives us a pretty clear framework, actually. It outlines several key factors to think about. Right. And the first thing the source really emphasizes, and this is absolutely non-negotiable, is checking their licensing and credentials.
Yeah.
You just have to make sure the provider is licensed to practice medicine specifically in California.
Yeah.
That's baseline.
Right, baseline. And beyond just that basic license, the source suggests looking for other indicators, sort of signs of deeper expertise.
hmm
They point to things like board certifications or memberships in professional organizations.
hmm
For instance, they specifically highlight Dr. Brandon Stark's credentials. He's board certified in addiction medicine and also a fellow of the American Society of Addiction Medicine, FASAM.
Yeah, and that extra layer of certification, it tells you something, doesn't it? It speaks to a provider's commitment and specialized knowledge, especially in a really complex field like addiction medicine.
Okay, so licensing first. What's next?
So moving on, the source talks about the range of services offered. That's another critical factor. It's really important to look for a broad scope of care, particularly if you think you might need ongoing or integrated support, not just, a one-off urgent care visit.
And that seems especially relevant given what we just discussed about Northern California, where finding specialists locally can be tough. How a provider pulls services together matters.
Exactly.
The source lists quite a comprehensive suite to look for. Primary care both for sudden things and chronic conditions. Preventive screenings, wellness checks, mental health support like evaluations and therapy, medication-assisted treatment or EMET, addiction counseling, and even help connecting you to in-person services if needed, like rehab or sober living options.
That's a broad range.
It is, and the source notes that Stark Medical actually integrates all of these onto their platform.
And that integrated approach, it's really key, especially when you link it back to those access challenges we talked about. Factor 3 is all about the telehealth technology and privacy. This is huge.
Absolutely.
You need that assurance that your sensitive health information is being protected. That means using platforms that are HIPAA-compliant.
And you should feel, comfortable asking questions about the tech itself, right?
Definitely.
Like, are the video calls encrypted? Is there a secure patient portal for messages and seeing your records? How do they handle electronic prescriptions safely?
Oh, good questions. The source mentions Stark Medical uses a platform that's designed to be user-friendly and secure, really focusing on safeguarding patient data while making it easy to connect.
Good to know. Okay, what's factor 4?
Factor 4 is reviews and reputation. Basically, what are other patients actually saying? Looking at things like online reviews, maybe testimonials on their site, or even just good old-fashioned word of mouth can give you really valuable insight into the patient experience.
Yeah, you want to look for comments about professionalism, how clear the communication was, how easy the technology was to use, and importantly, whether people felt they actually got positive results from their treatment.
Exactly. The source we have notes that Stark Medical is quite proud of its growing reputation for delivering high-quality, evidence-based care and also for building strong patient relationships.
Relationships matter in healthcare, even virtual ones.
They really do. Okay, the fifth factor, ease of access and scheduling. This is especially vital for telehealth. I mean, the whole point is supposed to be making things easier, right?
Right.
So you want flexible appointment times, a simple system for booking those appointments, and ideally, maybe some way to get support between visits if needed.
And this point, it really circles back nicely to our Northern California focus. The source highlights that Stark Medical lets you book online through their patient portal, pretty standard Nabbit. Crucially, they offer statewide telehealth access across all of California, and that is incredibly valuable for tackling that difficulty people in rural or underserved areas face just getting a timely appointment.
That statewide reach is a big deal.
It is.
And finally, factor 6, a patient-centered approach. This means finding a provider who, genuinely listens to you, engages with you, respects your individual need.
Someone who works with you?
Exactly.
Yeah.
Works with you to create a personalized treatment plan. And, critically important, maintains a non-judgmental approach.
It's hard to overstate how crucial that is, isn't it? Especially if you're managing complex, ongoing health issues, thinking about chronic conditions, or navigating something as sensitive as substance use recovery.
Absolutely vital. The source specifically mentions that Stark Medical is known for offering compassionate, stigma-free care, and for tailoring their plans to the unique circumstances of each person, and sometimes their family too.
That personalization sounds key.
It really is. Now, while telehealth offers all these benefits, the source also gives some warnings, common mistakes people make when choosing.
Ah, okay. What should people avoid?
Well, first off, don't choose just based on the lowest price tag you find.
Tempting sometimes, though.
It can be, but cheaper might mean you're compromising on the quality of care, or maybe the service isn't as comprehensive as you actually need.
That makes sense. Quality over just cost. What else?
And definitely, as we talked about right at the start, do not skip verifying those credentials.
Seems obvious, but easy to overlook, maybe?
You'd be surprised. It's such a crucial safety step. Don't assume. Always verify the license for California.
Got it. Verify credentials.
And another potential pitfall is assuming all telehealth services are basically the same. They're not. There's a really big difference between, say, a platform that's just set up for a quick, one-time urgent care visit for something minor.
Like a sinus infection or something.
Exactly. Versus a provider like Stark Medical, which the source positions as specializing in more complex, ongoing, personalized treatment plans. Different models entirely.
Okay, that's a really important distinction. So pulling all these different insights together from the source material, what really makes Stark Medical, according to this info, stand out as a trusted choice, especially thinking about those needs in Northern California we discussed?
Well, the source seems to position them as more than just, a virtual clinic platform. The aim described is to be more like a dedicated healthcare partner, really focused on providing holistic long-term care for individuals, sometimes even families.
And that leadership piece seems important too, being led by Dr. Brandon Stark. With that specific board certification in addiction medicine, it really underscores a focus on a complex area of care that's often hard to access locally.
Definitely. And their scope of services, which we touched on, it's designed to be comprehensive. Primary care, chronic disease management, wellness, preventive care, MITE, addiction counseling, mental health support, those referrals.
Right.
The idea is to address multiple health needs in one place, which directly counters that problem of having to drive all over for separate appointments.
Which is a huge barrier for many, and the accessibility part feels central to their model. based on this.
Yeah, delivered via secure telehealth technology available statewide across California, but with that specific mention of focusing on helping communities like those facing shortages up north.
Mm-hmm.
Ultimately, the source suggests their whole philosophy is built around providing compassionate, accessible, truly human-centered care for every stage of life. And bringing that care right into the comfort of your own home doesn't matter where you are in California.
So the main takeaway seems to be, as you navigate the options for telehealth care, the source really encourages making a very informed decision.
Absolutely. Take your time, evaluate potential providers using these kinds of factors we've discussed today,
Yeah.
and really don't hesitate to ask questions. Ask about their services, their
Hmm.
technology, their approach to care. Get the information you need.
It makes sense, and it leaves you with a final thought, really, based on everything we've discussed. Given those significant healthcare access challenges, particularly in regions like Northern California, how might the ongoing evolution of these telehealth services continue to reshape how and where people actually get essential care, especially thinking about those with complex needs like managing chronic conditions or navigating addiction recovery? It really makes you wonder about the future of healthcare delivery, particularly in places that need it most.